hello. This is my 1 week post-op surgery update. So 1 week ago today, on August 12th, 2020, I had double incision top surgery with Dr. Neil Zemmel in Richmond, Virginia. I was super pleased with his office and with him as a surgeon and all of that stuff ahead of the surgery, so I was really excited for this and very hopeful for how it would go. The day of surgery, everything seemed to go smoothly. We were mostly on schedule, and then I went home from the hospital. And in those first 3 days post-op, I was in no pain at all whatsoever, but I was in, this big layer of tape on my chest with gauze underneath the tape, and then in a compression vest. So I was not able to see my chest at all whatsoever for the first 6 days. 5 or 6 days. So I had surgery on Wednesday, then on Friday I had a preliminary checking up on you before the weekend post-op appointment. At this appointment, they just made sure that I was doing stuff right, and that I was generally taken care of and feeling okay. Then on Saturday, I started to have pain, but it wasn't unbearable. It was totally fine, very manageable, but I could feel myself being sore. Now, in those first 3 days post-op, I was pretty tired. I took very, very long naps during the day. Like one day I napped for 6 hours during the middle of the day, and then I slept for like 10 hours that night. And that was pretty normal for those first couple of days. I was sleeping a lot, but I was also doing other stuff. In general, from the beginning, I was like, up, able to like walk around and like get out of bed and like go to the bathroom and like get up and walk around the apartment, and that wasn't really a problem at all. Now, the bed that I've been sleeping in is kind of like a nest where it's like scooched up against a wall on the back, and then there's like a barrier on the right side, and then there's a barrier on the left side, and so it's not really till halfway down the bed that I can actually like exit the bed. So that was a little bit challenging, just to like start to figure out how to like get my legs so that they could fling off the edge of the bed, so that they could like pry the rest of my body out of the bed without using my arms. So that was definitely the toughest adjustment the first couple days. But like I said, I was sleeping a lot, so it wasn't really a super huge deal. I was sleeping like almost upright. It was like a 45-degree angle, maybe a little bit like higher than that. And so it wasn't comfortable, and I definitely started to feel like lower back butt was like very happy to get up and walk around all the time. In the first week as well, I felt very much like my shoulders were like pulled forward. And so it was hard to try and remember to like sit up straight and all of that, just because I could feel stuff pulling a little bit. Doc said that's totally normal, like that's not a problem, sit up straight. So I started to try and do that a little bit more after my Friday appointment. On Saturday, I started to feel a little bit of pain and discomfort. On Sunday, it was kind of the same. By that point, I could really feel the drains in my sides. Like I could feel where they were coming out of my body. I could feel my arms rubbing up against them. It just generally wasn't pleasant, but it was manageable. On Monday, it was to the point where I was like, I feel disgusting. I really, really want a proper shower, like with water and everything like that, because at that point I'd been baby wipe showering like every day as much as possible kind of thing. And by Monday I was just feeling disgusting. It might have been because it was like kind of humid, and so I was sweating a little bit. But in general, I was just not feeling clean. Also, by like Sunday, I had noticed that my hair was really greasy, and that started to bother me, and my face felt really oily and gross. So in general, I was just ready to like be clean and like do normal human things, instead of like, washing my face in the sink with dino arms and like, wiping down with baby wipes and that sort of thing. Tuesday morning, so at that point, this was yesterday morning, I had my first like official, like we're doing things now, post-op appointment with my doctor. At that appointment, they took out the drains. It was absolutely horrible. The drains getting yanked out of my body was so painful. I've heard other people say that it's uncomfortable but not painful, but that was painful. That was the worst feeling thing of this whole ordeal so far. It was not good. The drains were in me about like 4 to 6 inches. It was like maybe that long. It was like sizable. And so it just like, I couldn't feel the drain coming out on the inside, but on the surface of my skin, I could very much feel the drains, and it felt like pulling something out of a wound, which is kind of what it was, but it was just not good. Since the drains have come out, I still have some soreness at the drain site. There's a lot of bruising. It's pretty like purple, especially on my right side. It's pretty purple, kind of gross, and like just generally doesn't feel good. But as long as I don't hit it or bother it, it's not like constantly bothering me like it was when my drains were like still in. The other thing I forgot to mention was before my post-op appointment yesterday, Sunday and Monday, everything started to get really itchy, and I just couldn't itch it. It was just not great, and like it took me several hours to fall asleep one of those nights because I was so itchy and I just was trying to not itch it. And so once all the tape came off, that helped with that, and like immediately stopped itching. So it was probably just the tape. So then after my appointment yesterday, they sent me home and said, hey, you can shower now. And they gave me instructions for like what to be doing in terms of taking care of my chest. And so essentially they told me, you know, don't touch the nipples. You can like, you know, touch the scars and like wash the scars and that sort of thing. Wash everything else normally. You know, put soap like up on your upper chest and like let the water like run down and clean like the nipples and all of that. Don't let the water directly come and hit the nipples, that kind of stuff. So the first thing I did when I got home yesterday was I went and showered because it felt wonderful and I was finally clean, and I was like low-key a little bit worried that they were gonna have me go another week without a shower, and thankfully that did not happen. Now, something interesting did happen. When I was in the shower, I got lightheaded and felt kind of nauseous and started to lose my hearing, and felt like I couldn't really breathe. And so that was weird. So I like turned off the water and then like literally just laid in the middle of the floor and was like, I feel like I'm dying. I hope I'm not dying. And so I called the nurse at my doctor's office, and they said, that's fine. You were probably just dehydrated or hungry. And so I ate something and I drank some water, and then I was totally fine the rest of the day. It wasn't really anything to worry about. It was just kind of freaky because in general I'm a pretty healthy person and stuff like that doesn't usually happen to me, so I was just like, oh no, am I dying? I was also home alone, so I was like a little bit freaking out that like if something happened, I was just like gonna be there alone for like multiple hours until someone would be able to help. But that didn't happen, and that was just me thinking of the worst case scenario, so you know, it was totally fine. Then today when I woke up, I noticed that my chest felt kind of bruised. Like it does feel kind of tender, but it doesn't like hurt that much necessarily. It just like, it feels bruised. Yeah, I do have a little bit of soreness around the edges of the incisions, like toward my armpits. And I do, like my chest does feel like it was operated on, but it doesn't feel like absolutely horrible or anything. The other thing that might be worth noting is post-op depression. So I was super duper ready to be very depressed post-op, to feel regret or to wonder if I had done the right thing and to have all these feelings, and that thankfully did not happen to me at all. The only things that I have been feeling have been ecstasy, being overjoyed, being really, really happy, being super confident in myself. Like I've felt physically, I felt great. Like visually, it looks fantastic whenever I look in the mirror. Emotionally, I just felt so good. And so I have not felt like down or blue or like depressed at all. I have not wondered if I would regret this. I have not regretted it. I have not wondered if I have done the right thing. I have known that I did do the right thing. So this has been such a wonderful, wonderful thing for me mentally and emotionally. So now that we've kind of talked about how I felt during the first week, I want to talk a little bit about aesthetics and how it looks. Okay, so in terms of how it looks, the scars are very thick. They're very dark. They kind of have a purplish tint. And I think it's because the surgeon used like this purple marker to like draw on me pre-op, so he knew like where to make the lines and cuts and stuff. And so I think I can still see some of that pigment. So I'm not actually sure how dark my scars are presently. They just look like purple or black. They are pretty thick. If I touch them, they feel very, very hard. It feels like they are thick, like going into me, as well as thick, like across the skin. And so they're very, very clearly big ol' scars. They also currently still have stitches going through them. Some of the stitches poke out in weird little places, so I can see those, I can like touch them. It's kind of weird, but you know, it is what it is. There are stitches that will dissolve themselves, and so I don't need to get them taken out, thankfully, because repeating the drain thing again would be horrible. I know that's not how it works when they take them out, but like, I'm just glad I don't have to go through anything else medically. The nipples are disgusting looking. Would not recommend just browsing and like looking at them casually because they're honestly kind of gross. They look like black, like pepperonis that got like super crispy in the oven because you burnt a pizza. It's like, they're nasty. My left nipple is, it has like a raised area that's like pretty big. Like it looks like if you took like the nipple-y part of the nipple, like not the areola, but the actual nipple, and you like flattened it into like a pancake and it just kind of like spread out. That's what it looks like happened. And I'm not a super huge fan of that, so I'm hoping that that's going to like go away and start to look normal eventually at some point. The right side looks a little bit more normal in terms of like dimensions and like size of what's there. So I'm hoping the left one kind of corrects and looks more like the right one. They both are very, very dark. They're like black basically. And the doctor said that they are basically scabbed right now and that over the next couple of weeks, those scabs are going to come off and it's going to be fresh new baby skin underneath and it's going to be much more normal. And that we're just kind of taking care of them and waiting for that to happen. So I'm hoping that during that scab coming off process that it takes some of the like weird extra pancake nipple part with it so that it's more of a normal dimension. Now my left nipple is a little bit jagged, it's not perfectly round. My right nipple is much more round. And then you can kind of like see the stitches that look like, I mean, they kind of look like patches that were just like patched on. So I feel kind of like Frankenstein-like, it's kind of fun. But anyhow. Now my entire right side is like half an inch lower than my left side. So like the scar and the nipple both are like offset a little bit where they're just like a little bit lower. You don't really notice it unless you like look at the scars like meeting in the middle because they're close enough that you can tell that one's a little bit lower. I don't know that you would necessarily notice just casually, but like I've been staring at it for like 24/7 since my dressings came off yesterday morning, so I definitely noticed. Now, I remember in my initial consultation when pre-op, before like surgery, when the doctor was measuring me, the measurements were not even. So I know that starting out, I was not perfectly symmetrical, not the same dimensions, not even, which is like totally normal. Like lots of people are like that. It's a totally normal thing. So what I've been telling myself is just that like, if this is the chest that I had been born with, chances are it would also have been uneven, and this might just be like the uneven that it would have been. So it's really more natural than if it was like perfect, kind of, I guess. I mean, that's why I've been telling myself, and somehow it's been helping, so meh. In terms of sensation, I can feel literally everything. I'm not allowed to touch the nipples, so I haven't tried touching them, so I don't know. But for all of the skin around everywhere, like I can feel everything and it feels totally normal. Like it feels just like it used to feel. It feels like my arm skin or like my stomach skin or whatever. It feels normal. The one exception is there's this one little patch underneath the scar on my right side, kind of toward my armpit, where it feels like muted sensation. Like I can still feel it, but it feels like kind of fuzzy or far away or like half numb. So I'm not sure if that's a permanent thing, or if it's still like nerves are regrowing or it's like coming back or what that is, but it's just a very small area and it's like relatively out of the way, like far on my right side. But everywhere else, above the nipples, below the nipples, above the scars and below the scars, like I can feel everything. I can't feel directly on the scars. Like I can feel them with my fingers, obviously. Like I can feel that they're like big and thick, but I actually, other than pressure, I can't really like feel something running across the scars. In terms of like contouring, there is like a raised area on each side toward the center, where it looks kind of like pecs. It looks like there's a lot of tissue there, but like pressing on it, I think it's just swollen. I don't think there's excess tissue there. Even if there was, like, it does kind of look like I have nice pecs, so I'm not super upset about that. If it were to stay, if it were to leave, it would be fine. I would just make my own pecs with, like, real muscle, and that would be cool too. So yeah, that's like the only part that I think is like kind of swollen is like toward the center on each side. Now, something I do want to mention that was really interesting is like my armpit tissue. So pre-op, I had like breast tissue, not excessive breast tissue, but just some breast tissue, like kind of like in the flabby armpit area. Like not in my armpit, but like, you know, like if I were to wear like a tank top or a sports bra or a binder or something, then like, you know, there would be like fat that would like kind of spill out on the sides. And that was breast tissue. And so I never wore tank tops because I did not like that there was breast tissue there. I could tell, I didn't like it. It looked gross. It looked like extra fat. And like, I just didn't like it. Realistically, most people probably would not have noticed that, but it was something that I was really, really aware of and I was self-conscious about and I did not like. So before my surgery, at one of my pre-op appointments, I had asked, and they said that a lot of people are born with more breast tissue in that area, and some even like going down like below like their actual breasts. Like some people have extra nipples and stuff too, like on their stomach, kind of like dogs. Anyhow, I had extra breast tissue like up in the armpit area that I was self-conscious about and I didn't like. So I'd asked them if they were able to remove that during surgery. And they said, no, that's not normally a part of top surgery. You can't really access it from where the surgeon would already be accessing the rest of the tissue from. Like it would be too far to kind of come up and reach into it to take it out. And so usually you would access it by coming in through the armpit, and that they could do that in a separate procedure. However, they said that they could try to like smooth it out a little bit during top surgery, which is I think exactly what they did because it looks so good now. So they said that they could try and like either pull down some of the tissue a little bit and spread it out, or even that as they were closing me up at the end of surgery, like just pulling the skin tight might like pull some of it down into the rest of my chest so that it wasn't concentrated there and didn't look like flabby. And I think that's exactly what happened because like now I like look at my chest and like it is not like it used to be. I do not have that extra like breast tissue there, which I'm so glad for because I'm so excited to get to wear tank tops now, and like not be self-conscious about that. And like, I mean, part of it is like just being flat in the chest makes it very conducive to wearing tank tops and I'm super excited. But also like not having to worry about that specifically as well is like very, very exciting. I'm so thankful that Dr. Zemmel was able to do that because it looks so good. It looks so good, guys. Also, at this point, I'm saying that, like, everything here looks, like, really good, just from the standpoint of, like, I appreciate that the surgeon is kind of an artist and, like, did a good job. Not so much from the standpoint of, like, oh, I'm, like, you know, very good looking so much. It's more just that, like, I'm really pleased with how I look now, and I very much give credit to the surgeon for that because he did an amazing, amazing job. Now, here at the 1 week mark, I do still have some discoloration and bruising. I am not horribly colored, like I'm not like black and blue everywhere. I am a little bit yellow right around the scars. Like along the scars a little bit above and a little bit below, it is yellow. And then at the drain sites, it is like a dark purple bruise on either side. The right side is a little bit worse, it's a little bit bigger. And so there is some discoloration going on. Obviously the nipples are not the proper color. They're like black, and that is going to be changing soon. I hope. And then obviously the scars are like very, very dark, like black, purple, dark, which will hopefully lighten to hopefully normal skin color by, you know, several years from now, but we'll see. But yeah, in general, everything looks really, really good. I'm so happy with how shirts look on me now. I am so, so happy with just like looking at myself in the mirror. It's just amazing. I got out of the shower today and I put a towel around my waist and I just felt complete. I felt so good. And then I just looked at myself in a towel in the mirror for no joke, like 5 minutes. It was wonderful. So yeah, 1 week post-op and already looking and feeling so much better than pre-op. This is just, it's so amazing. There are no words for it, guys. All right, well, that was my 1 week post-op surgery update. Thank you so much for watching. Until next time.